Thank you, everyone. My name is Addassa. I am lead mentor and acting programme manager for the Sickle Cell Society's Children and Young Persons Peer Mentoring Programme, which I appreciate is a really long title. Quite a mouthful. And I stand before you today to deliver this talk, not only as a speaker, but I also have lived experience. I was diagnosed with sickle cell beta thalassemia at 3 months old. And I was also diagnosed with type 1 diabetes at 3 years old, so I know exactly what it's like to live with 2 chronic conditions. So I thought I would jump straight in and talk to you about the society and how it was founded. So the Sickle Cell Society was founded in 1979, and it was actually founded by a group of really concerned nurses who thought about the lack of education and understanding about sickle cell and thought they would get together and try and spread awareness. And still today, the Society is the only national charity that supports and represents people affected by sickle cell to improve their overall quality of life. And the charity was really established to address the needs of people living with sickle cell disease and their families. So today, we still provide information, resources, and advocacy. So I thought I would give you a little bit of an overview about what sickle cell is, and hopefully you can understand exactly how it affects a person. So sickle cell is an inherited condition affected by the red blood cells. It's a mutated form of hemoglobin, which causes a distorted shape. So you can see here we've got sort of the abnormal hemoglobin and normal hemoglobin. We've got a red blood cell, which is nice and squidgy. It can fit through our blood vessels really easily. And then we've got a sickle cell, which is quite sharp. It's in the shape of a sickle. And it's abnormal hemoglobin. It's sticky. It doesn't get through the blood vessels as easily as a red blood cell. And we've also got a very, very small diagram here of what sickle cell looks like when it's blocking the blood flow. And this is what we call a sickle cell crisis. So sickle cell disorder primarily affects individuals with ancestral roots in Africa, the Caribbean, the Middle East, and the Mediterranean and India. And while these regions have a higher prevalence, it's really essential to note that sickle cell can occur in anyone, any individual from any ethnic background, and these affect all populations around the world. So approximately there are about 18,000 people living with sickle cell in the UK. That might seem like quite a small number compared to the UK's population, but in actual fact, it's a disorder that is growing year on year. There's about 400,000 people living with sickle cell trait, as well as 300 babies that are born with the full disorder per year. So you can see how that can impact year on year and how many people are actually being born. So that makes it one of the fastest growing genetic disorders in England and in the UK, and that's not counting the rest of the world as well. So our mission involves raising awareness for sickle cell disorder. We believe that everyone that has sickle cell deserves equitable access to healthcare. We believe that we can enhance the quality of life for individuals with sickle cell and working towards a better future for people affected by this condition. And we believe in raising awareness about the condition so that we can get access to new treatments and hopefully find a cure for all of the genotypes. So again, we're just looking at the prevalence of sickle cell and the trait. It can vary. So we know that it affects people of African and West Indian and East Asian origin. Right now, there's about 1 in 500 individuals of white British origin that have the full disorder. So we know that it's spreading to different people of different backgrounds. And it can actually affect people in a range of different ways. So we've got anemia, we've got recurrent episodes of pain that we call a sickle cell crisis, but it's also not uncommon for people with sickle cell to live with chronic pain, and that's pain that doesn't go away. There's also a risk of stroke. It's not uncommon to hear about childhood stroke and potential organ failure, because wherever the blood flows is where sickle cell can affect. Individuals with this disease are prone to experiencing pneumonia, increased infections, acute chest syndrome, and facing elevated possibility to other infections. And normal infections like the flu or a cold can really, really affect someone with the condition. So when we start to look at the Sickle Cell Society's impactful initiatives, one of the things that we've done really well at the Society is produce reports and research into the condition. One of these reports would be the No One's Listening report. So the No One's Listening report, we've got some cheers, second row. So the No One's Listening report was actually triggered by the coroner's report into the death of a young sickle cell patient. His name was Evan Nathan Smith. He passed away in North Middlesex Hospital after receiving poor quality care for his sickle cell crisis. And it was actually the mistakes that were made in his treatment that led to this focus in the lack of understanding about sickle cell and the battles that patients have to go through and the terrible consequences that can come about as a result of the lack of understanding. So the report highlighted substandard care in general wards such as A&E, and also just the low awareness amongst healthcare staff, professionals, inadequate training and negative attitudes towards sickle cell patients. It also highlighted inadequate investment into sickle cell care in the NHS network. It's a death that shouldn't have happened, and deaths happen as a result of sickle cell and inadequate care all the time. But this one brought into sharp focus all of the failings that can happen quite often. As a result of this, the NHS have increased investment to provide more resources and also dedicate better care and treatment to people with sickle cell in the UK. So we've got a few examples of this. So the community service models, patient advocacy, wellbeing system therapies, management and transition. So it's really allowed for better patient-centred care, improved outcomes and increased quality of life for people living with sickle cell in the UK. And one of those initiatives that was invested into is our Sickle Cell Children and Young Persons Peer Mentoring Programme. So many of you might have heard of this beforehand because it was a pilot in City and Hackney a few years ago in 2017. And after a short pause because of funding, of course, the pandemic, which everyone was affected by, we relaunched the programme in 2022, last year. It's been a full year of lots of work going on in the sickle cell space. And a year on, we're in the process of actually scaling up to offer it to all of the children between 10 to 24 across London. So the programme really looks at pairing individuals with lived experience of the condition and allows young people to have the space to learn, to build, to be encouraged by someone, and to build a long-lasting relationship with someone who has been through everything that they've been through before. And just in 12 months, we've received about 60 referrals just from East London alone, which is an amazing achievement that we're really, really proud of. So what other services does the Sickle Cell Society provide? Well, we've got support groups, we've got a screening programme. We actively engage in research and clinical trials. We're always trying to look for different ways that we can provide meaningful access to medications, to cures. We have a helpline team that can really help to advise people who might need just a little bit more information about where to access services. We have children's activities and also our blood donation campaign. So let's go into a little bit more detail about that. So we've got Give Blood, Spread Love. So Give Blood, Spread Love is the Society's blood donation project. We work with Black heritage communities to raise awareness for the need of ethnically matched blood to treat people with sickle cell. So we really try and increase the confidence and the education in our communities to get them to donate blood. A lot of the time, people might not want to donate blood for cultural reasons or for maybe religious reasons, or maybe they just don't have the awareness or the education behind it. So our drive is to really recruit new donors to the blood donation register. And for many patients who have sickle cell, they need regular blood transfusions to treat the anemia, to treat other symptoms, including stroke and acute chest syndrome. And for many, receiving blood, it can really save a life. We need ethnically matched blood. So anyone that is of Black heritage or mixed heritage should come forward and donate blood. The best blood type is the RO blood type. So if anyone's RO, come forward, we need you. So we really want to encourage people to donate. And our children's activities. So every single year, for as long as we can remember, we've run children's holiday for young people living with sickle cell. And for the 3 years over the pandemic, we actually did these virtually. So we didn't stop, we kept giving. And this year, we actually decided to do a sickle cell family retreat. We recognise that a lot of families have maybe one child with sickle cell, the rest of the children don't, they feel left out. They're also young carers. Some people have children who have sickle cell or might carry the trait. And we really wanted to offer a family retreat for people to get away, to enjoy the August summer holidays. And our holidays are free. So it's a weekend full of education, adventures, learning, and just a team of amazing, fantastic volunteers come every single year to support the holiday. And we've got some feedback here from a participant. It was amazing, it was really fun, and it's been great to meet people that you can relate to. So that's some amazing feedback that we've got. And our screening programme. I believe I was just asked a question on this just before I began this talk. So the Sickle Cell Society really plays a pivotal role in trying to shape the UK screening programme. And in response to the NHS Plan 2000's directive to establish a comprehensive screening for women and children by 2004, we launched the Sickle Cell and Thalassemia screening programme. So essentially it's giving families and children and couples the opportunity to find out if they have a higher chance of having a baby with sickle cell. And it's really important that we keep this screening programme going because we're having more births, which means we need to put that education out there so that we can limit those births. Pregnant women and couples who have a higher chance of having a baby with sickle cell need that education. They might be presented with some difficult decisions that they have to make. And if they have that prenatal diagnosis, they can make those decisions earlier with the help of a consultant and some counselling, of course. And our lovely helpline team and support groups. So the SCS helpline provides confidential information, guidance and emotional support to individuals and families affected by sickle cell living in the UK. They can advise on how to manage sickle cell. They can provide information on social and welfare issues, health and education provision, housing and benefits, so on and so forth. The helpline team is really useful for a lot of people living with sickle cell, particularly people who have maybe come from another country, are new to the UK and need some help about navigating different services. So how to get involved and support? You could refer a young person to the peer mentoring programme. We've gone London-wide now, so we're really looking to support more young people. We take referrals from all different types of stakeholders. It might be a clinician, you might be a researcher, you might just know someone who has sickle cell and might need that support from a mentor. You could donate blood and find out more about how you can donate blood. So we've got a lot of resources on our society website that you can check out, and you can follow us on social media. In closing, I just want to express my gratitude for giving us the platform. It's places like this and events like this that give us the opportunity to spread awareness and to give people more education about sickle cell. And with your ongoing support, we can continue to make meaningful impact. And thank you very much.